brow lift, incision along the hairline, lifting the skin off of the skull. I had a tech quite young.
She passed out.
She did pass
Yeah.
out. You saved the day, honey.
Yeah, I
You
went
came
in and scrubbed. Yeah.
Oh, I want a beauty that'll give me that glow. The kind of body that'll make them say, whoa. Get it right with the knife who slays. Beauty and the blade. Yeah. Get it right with the knife who slays. Beauty and the blade. Get it right with the knife who slays. Face and body. And the blade.
All right. That's a beautiful.
Good morning, Go Country 105. I am Ashlee Park, alongside with my handsome husband.
Handsome indeed. Dr. Edward Park here.
I'm going to ask you a couple true or false questions.
Right,
Are you
let's
ready
go.
for this?
I'm ready.
Your heart, the average heart, beats 10,000 times a day.
Ooh, my average heart beats 1,000,000 times for you, baby.
Oh
No,
my goodness.
10,000 times a day. That's actually a little bit low. It actually is 100,000 times a day.
Wow.
So to keep you alive, it's going fast. 35 million times a year. That's a
Wow,
lot.
that is a lot. Okay, I have one more. So this is your favorite. Cracking your knuckles, popping your knuckles is bad for you.
I wish it was. I know you do it. Monet, my daughter, does it. Her back cracking.
She even wakes up in the middle of the night and does a little
She does.
twist.
She does. It
Yeah.
makes me cringe a little. I don't do it, but it's actually not proven to be bad for you. So it's okay. I mean, I don't recommend it, but y'all do it. Do your thing.
It feels so
It's
good.
fine. So what we wanted to do on this episode is do an update on life as we know it with us. It's been about a few months that we've been doing this show on Go Country
Right.
105, and we wanted to just give a little bit of an update on where we were today. So let's just talk about maybe rewind like 20 years when we met
Okay.
or so.
Back in the day.
Back in the day.
So let's see. About 19 years ago, I was working for another plastic surgeon. And he told me one morning, he's like, oh, just make sure everything is like good going on in here because we have this new young surgeon that,
Handsome
that Dr. Sorowski is bringing in
Right.
to see if he's going to start performing some surgeries here. So then you came on in, you started practicing there.
Right.
I don't even know how long, like how many days a week were you there?
So this was early on in my plastic surgery career to know how face and body started. I joined with a senior surgeon named Dr. Sorowski, who, a little bit about training, he was ENT facial cosmetics, so a little bit different from what I do. I'm trained in general and plastic reconstructive
Right.
surgery, and the difference is I operate all over the body. He stays in the head and neck. This is a very important distinction between the two of us. He was board certified in cosmetic surgery. That's a huge difference in what I've been trained in, which I'm
Right.
board certified in plastic and reconstructive surgery. So he was looking for kind of someone that was an expert in the body, which is where I started training with. And he would do facial cosmetics, facelift, rhinoplasty, everything above the neck. I kind of concentrated more in the breast and the body area. But since I wanted to get experience with the face,
Right.
I worked with your doctor, whose
Yeah.
name was Dr. Asha.
Because he
And
only did body.
so he only did
Yeah.
body, and that allowed me to do facial rejuvenation at his practice. And I met the lovely Ashlee.
Yes.
Conrad at the time.
And oh yeah, I was
Different
a Conrad. So yes, I remember you coming in. I don't know, I guess it kind of made me a little nervous because I always practiced with one
I
doctor.
tend to make people nervous.
Oh my goodness. And then so there was this big whiteboard and it would say, at the time I was a scrub tech, not a nurse yet. And so I would erase that name and put somebody else's name so I didn't have to work with you.
Thanks.
And then we go a few years down.
So,
And-
well, let me just tell you one of the stories about our surgery. So, I think you operated with me, and at the time, I was doing brow lifts. So, just a little bit about brow lifts. It's a pretty big surgery because I'm making an incision along the hairline, and I'm I don't want to use the term de-scalping, but I am lifting the skin and the forehead off of the skull. And I believe at the time I had a different tech who was quite young and got a little...
She passed out.
She did pass
Yeah.
out. So that can happen in surgery. I mean, it is a big surgery.
I
came
am
in.
like in awe that you remember exactly what procedure it
So
was.
it was a
Because now
forehead
I'm
lift.
thinking about it, I'm like, oh yeah.
So if there are two surgeries, if I have a new employee and they're learning about my reconstructions and my rejuvenations, I would say the top two that are a little bit difficult to kind of, watch is a rhinoplasty because I'm opening the nose, there's cartilage,
Yeah.
and definitely a forehead lift where I'm showing bone, there's muscles and all of that. So
Yeah.
people do get a little bit woozy. So I believe you saved the day, honey,
Yeah.
and
I
you
went
came
in
in
and
and
scrubbed.
scrubbed,
Yeah.
and
And
you
then
were awesome.
time goes on. I think there was like a little bit of a break there that you weren't coming for like quite some time. And then you were doing consults on Fridays there or something. And I had Fridays off. You guys all remember MySpace.
Oh gosh,
So I get a
that's
message on
dating
MySpace.
us.
I used to love MySpace though. So then you could put like music with your,
So your group was Paramore. I remember that.
it was
That was a long time
Love
ago.
Paramore. So I get this message and it's from my husband. At this time though, it's from this guy at work that I will not date anybody at work.
So you
So
thought.
stay away. No. Tell them what you said in your message.
So
'Cause
I had tickets to Wicked at Pantages Theater in Beverly Hills or in Hollywood, which is a great Broadway show, by the way. And so I messaged Ashley on MySpace and said, "Hey, I've got 2 tickets to Wicked. Are you interested?"
Yeah.
And your response was,
So in my mind, I didn't think like, oh, this guy's trying to date me. He wants to take me out. Like that wasn't even in my mind. So I responded back and I said, okay, well, you know what? Let me see if I could find a friend to go with me and then I'll buy the tickets from you. And
"Fail."
then I get a message back and he's because that show was going to be like in 2 days.
Right.
So he messages back and he says, no, for you and me
Yeah. No,
on a
silly.
date. And I was like, oh my gosh. I remember the next day I had to go into work with you. And I was like, oh my,
Yeah.
like once again, erase my name on the board, switch it with somebody else's name.
So you did say yes. You came
Yes.
out on the date. So that was our first date. Wicked. I remember the restaurant was, y'all probably know, Sky Lounge in Hollywood.
Yeah.
Oh, the restaurant's name was Asia de Cuba.
Yes.
It's no longer there. It
Yeah,
got,
now
but
it's Sky Lounge, right?
yeah, Sky Lounge is right next door. We did that. We went to, I'll call it a dancing area. It was called The Social.
Oh,
I'm
yeah.
really dating myself, guys. This is a long time ago, but I tried to hold your hand. I mean, there was all sorts of business going
Yeah,
on.
that was years ago. That was
It was
back,
good.
if you guys remember Laguna Beach and the hills, that was their hit club to go to.
Social.
Yeah, that was fun though. And then we
was
just
good.
kept going on like small dates here and there. And
Gosh, and then 4 kids later, where are we today?
yeah,
That's a
where are we
lot of
today?
time.
You know, I was just telling somebody earlier, I'm like, gosh, like I remember when my kids were all little. I mean, there was like 3 of them that were in diapers, and we had all 4 of them at one point were in car seats.
That was challenging.
You used to think it was hard, but now looking at where we are today, our kids are great. Life is great.
Yeah.
It's
a different
gosh,
busy.
looking back at that, I would go back to that day.
I always say that, babe. I
Yeah,
say,
you know.
one of the things I always say is just we got to enjoy the kids and life now
Yeah.
because, I mean, it just time flies by. Our oldest is now 17 and we're looking at colleges. I mean, it is.
And he's driving, which is very scary for me.
I don't know. I like it. I want to take him to the track and,
Yeah,
I've
so
got
scary.
him pumped up to do a little bit of racing.
But
I
it's
want to
just-
know a little bit about how you got through nursing school with, kids, and then going into the practice. How did you like juggle all that? Because that looked hard.
Oh my gosh, just thinking about that, I just got this overwhelming feeling.
Like PTSD.
So I decided to finish nursing school. We already had Maddox, and then I was pregnant, early pregnancy with Miles.
Yeah.
And so, as we all know, that a lot of women, when they get pregnant, they get very nauseous, sensitive with smells, and I'm already sensitive with smells. So then, like when I was in class, it was fine. But then when I went to the rotations, I had to take a little bit of a break because
Right.
the smells, and when you're going through nursing school and you're a nursing student, the staff at the hospital give you,
They're mean when they go through
they
rotation. It's
are.
hard.
The stuff that
It's
they don't want to
when
do, that's what they pass to
yeah.
us. So I took a little break. And then when our second son, Miles, was 8 months old, I went back. I then had to complete all my rotations,
Right.
and that was tough.
It was tough. I don't know how you
Yeah.
balanced it. And I give a lot of credit to moms and all the nurses out there and physicians that are going through raising their kids and
Yeah.
balancing it. And then what was super cool in terms of like our career and how we got to where we are is I went through a massive change when my senior partner retired. I became solo, and sometimes the staffing gets changed. We lost a lot of staff, including my injection nurse.
Yeah.
So I'm like, "Hey, honey, you think you can come start injecting my patients with Botox
Yeah.
and fillers?" So you started. I don't know how you learned to do that, but
Well, I went
you
to,
started injecting
yeah.
the
So
patients.
before, our nurse that used to be with us, before, she said that she wants to go into retirement, this and that, she started training me. And then I went to additional classes outside of our practice.
Right.
Um, and when I very first started, my goal was to open a med spa. I
Which you
still want
did.
to start a skincare line. Maybe that will be
That's
coming, but
coming.
so I wanted to open up a med spa, and that was my biggest goal. And I got there, I opened it up. It was
You
my
did.
baby, and it grew, and it's amazing. And then
It's still there.
it's still there, but I decided to take some time off and be with
Right.
our kids because I realized that the time is just flying by.
Yeah.
And it's like, I feel like when I tried, I don't know about for you, but because I'm having to pull up photos for Miles's 8th grade graduation.
Yeah.
So I'm going through my photos on my phone and my computer, and I'm like, gosh, I don't even remember that.
Yeah.
Does that happen to you?
I don't remember a lot because I'm always thinking of a gazillion things, but I will say that that was honestly one of my happiest moments in our kind of career slash relationship slash family because just to brag a little bit about, my wife, her injection talents. When you are going to come for a consultation, of which you can call us at 1-888-900-9065, 1-888-900-9065. And if you're going to do a consultation with either myself or when Ashley was doing it, you have to go to someone that's experienced.
Right.
And I think more than, their training and whatnot is their aesthetic eye. And I do believe, to brag a little bit about me and you, is we have a very keen eye for aesthetics. And what Ashley was able to do is really, and still do, is inject by listening to the patient. Tell me a little bit about your approach in analyzing, someone's
The
face
face, yeah.
as you're doing filler consult.
I always loved art. I wasn't such a, you draw great. I wasn't such a great, drawing, but I loved like creating art. And one of my favorite things that I at one point did was sculpting for pots. And
Kind of
it's
like
just like,
Ghost, where you're like, we should do
yeah,
that scene.
that's why
It's
I
coming.
got into it. 'Cause I was like,
Yeah.
this is so romantic. Now you
doing
have to
that.
take me on a date, and that's what we're
Okay,
gonna go do.
I will
So you
learn
have
to
to sit
sculpt.
behind me. We're gonna play the song.
Okay.
Actually, when I got into nursing, I thought I was 100% because I love kids. I love helping people.
Pediatrics.
I thought I was gonna
I
go into
remember that.
pediatrics,
Yeah.
and when I had that hospital rotation, I actually got kicked out of that rotation because it was just so sad. When you're in the medical field, you have to put your feelings aside.
Yeah.
It doesn't matter. Like,
You're
you're
right.
there to take care of the patient. It doesn't matter their family dynamics. You have to put all that aside. And that was really hard for me. And then, I had to graduate, I had to continue my pediatrics. And in between scrub tech and nursing, I did get my esthetician license.
That's right.
And I started to fall in love with skin, all around. And I would see then fillers were getting a little bit more popular at that
Yeah.
time. And I was just like, oh my gosh, like this would be so much fun to create. And I remember even before I even started injecting, I would go in and assist Dana and I would just, help her out.
Right.
And then like, actually, I remember my very first patient that we had to bring a model to the class. Oh my gosh,
Who
they
was
said,
that?
oh,
Yeah.
Jen.
Oh, Jen.
So, and I just like, she was like around, I would say in between 35, 40, 45
Right,
years
which is a
old.
good age for
Yeah.
injections.
So she had Halloween and all this and that. And I just love, like, I am not one that people always ask, like, do you go out in public and you look and you're looking at me and you're like, what do I need done?
Yeah,
What
I do
no,
that a lot.
I don't. I don't. Unless somebody asks me, then I will
Yeah.
say. But I remember having her on my chair and they told us, okay, we'll provide you with 20 units of Botox. It was an Allergan class.
So talk a little bit about, I think the audience wants to know, how do you, do your consult if you're looking at me or someone?
So they give me 20 units of Botox and 2 syringes. And I'm looking at her face and I'm like, that's nothing. You want to start. So you start from here and you work your way down. And I'm like, gosh, I could really just give her, I know you don't like me using this term, but I could give her a liquid facelift.
Sure.
If I just like hold this back and I put some here, it's going to hold it back and it's going to pin it back.
Right.
If I do this, if I do that. So my biggest thing is like, I will never say anything to anybody until they get in my chair and I go to town.
Right.
Not that everybody needs like a whole lot, but it's just looking from the upper part of the face down to the chin, and it doesn't stop there. Then we go down to the neck.
Right.
And then
what areas they may not know, but what's Botox best for? Where in the face?
yes, so Botox is a neurotoxin. Oh, I went blank. And there's also Dysport. There's other ones, Xeomin, Jeuveau. So what these do is they paralyze the muscle for about 3 to 6 months. So this is something that you would be getting injected with twice a year. Originally, we started just around the eyes.
Right.
Forehead, between the brows, but now we could go into the nose to help the movement from the nose dropping, go into the lips from helping from the smoker lines.
What age group would you say, hey, let's start Botox, let's do this?
I think it depends patient to patient,
Yeah.
but I would say in the early 20s.
Yeah, I agree.
But there are a lot of patients nowadays, there's so much sun exposure and looking at our, phones, the computer, so they're aging a lot more. And also like with, the necks, like you see more of, the bands and the double chins because people are looking at their phones like this, and a lot more people are out in the sun, not wearing sunglasses, so they're squinting. So paralyzing, I would say
about 20s.
Yeah, I would say start at 20.
I agree with that. And let me just say that people are afraid of Botox. There are literally 0 to no side effects. I mean, once again, if the injector is a little bit careless and puts too much, they can paralyze to the point where the brow can droop. Botox, just to reiterate, it is freezing your muscles of lines of action. I'm a good candidate. I'm a bad boy. I don't do Botox, but I'll show you real quick. Smile lines, frown lines, and raising brows. Those lines are muscle motion lines, and we want to prevent those. Because let's say for me, if I've already got lines and I'm going to do Botox too late, I can never irreversibly erase those lines.
Right.
But that's why when you start in your 20s, it's very important because you're doing it for maintenance.
Yeah.
The analogy is like in your car, you're doing your oil changes to keep your engine fresh for the life of that engine.
Right. And why I suggest, a lot of you are thinking, wow, that young? Why would you start injecting that young?
It's prevention.
But just like you said, it's preventing it. So when you start seeing some movement, yes, we all move, right? But when you start to see the lines kind of settle in at the end of the day, that's how you know it's time. And if you started at a perfect time and you're staying on top of it twice a year, you're not going to age.
And
that muscle isn't.
Then you're going to avoid me doing your forehead lift at age 50 versus age maybe 60, 65. So again, I just think it's such an important maintenance part of, keeping the aesthetics fresh and rejuvenating.
Right.
How about fillers? When would you say you started age of fillers on patients?
Fillers are, I would say, there's this whole trend that was going on with Kylie Jenner. And so there were
The
patients
lips.
that, I mean, there were even patients where their moms were coming in and asking, like, oh, if I sign this paperwork, can they have
Yeah.
their lips done? But no, we've never done that.
Right.
So I would say you can start at 18 years old. But I mean, the typical age of when somebody actually starts fillers, and when we're talking about dermal fillers, we're talking about filling up the area. So as we age, we start to get a little hollow here, hollow here. So we're just giving that natural plump.
Yeah.
When we go into the lips, if it's an aging lip, we're just helping like give that life back to the lip. But there are patients that they
Right.
want these big lips that, you know, I don't see it as much anymore.
Yeah.
But there are patients that do, and there's nothing wrong with that. That's their personal preference. But
Yeah.
so derma fillers, like you've heard of Juvederm. There's a
So
whole
many.
line of them.
Yeah.
Yeah. So that's to give you volume.
Right. What are the 3 areas that you think are important to fill if I
So
were a new patient? Yeah.
right. It depends on the age, right? So let's say somebody that's in between 35 and 50, where, you know, everything starts to fall because there's this gravity. We hate gravity. But
Gravity and deflation.
yes. So you start to get a little bit droopy here. So if we put some filler into the cheeks, if you're ever in the mirror
Exactly.
and you're like, oh,
Right.
do I need a facelift? Do I need so we would go into the cheekbone, the jawline. I think everybody like to make it look, I don't know, I think to make my patient look perfect, I like to go
Perfect.
into the cheek, in the jawline, the chin, and a little bit in the lips, in the
Yeah.
mid part of the lip.
Yeah. And I think, going over a little bit about aging and how we age, you hit the nail on the head. When we talk about gravity, there's also, I use the analogy, you hear me all the time, a grape turning into a raisin.
Right.
We're all going to be raisins at 90. Sorry, guys.
No.
So when we shrivel, I don't want to use that word, but when we deflate, gravity plays a role. And I think the first area that you talked about is the cheeks. So when we're looking at the cheeks here and we see the element of volume going into what we call the nasolabial fold, what we really want to volumize is the cheeks. That is the primary, I would say, filling region versus like, didn't we inject in the nasolabial a little bit too much?
I think that was like in the beginning when we all started injecting years
Yeah.
ago. It was like, okay, so to get rid of, because we weren't really going into the cheek, it was like to get rid of those nasal
Right.
folds, we're going to go into directly right into that fold, put some in the lips, but then it starts to give a little bit of like a monkey.
Yeah, like a mouthy
Yeah.
monkey. And yeah, I agree. In the early ages, about 10, 15 years ago, we were injecting these areas. We really need to look at the primary
Right.
focus of aging, which is volume in the cheeks, dropping into the nasolabial folds. So once again, go to a nurse injector that is very, very experienced and is listening to what your goals are. I think your comment about the lips is a good one. I think
Right.
we don't like to do anything too extreme if you're trying to do these Kylie Jenners and stuff.
Yeah, and it's like you don't want to look full, you want
Yeah.
to look youthful.
And natural.
Yeah.
I think both you and I kind of pride ourselves in being natural with our results. Once you're done or you're doing too many fillers and
Right.
you're like, wow, I really need to do a lift, and I come on board, I think the most common comment when they're seeing before and afters and looking through my book, they're saying, wow, these look very natural. They don't look pulled. We're not doing like Kenny Rogers, like, woo,
Right.
it's not.
So what if
overly
a
done.
patient comes into you and they've been having injectables, derma fillers to, lift their face and they come into you and their face, you can tell that they've had a lot of derma filler, but they're like, oh, you know what, Dr. Park,
I'm sending it back to you.
no, I really want a facelift. Like it's just not getting, do they have
Yeah.
to wait a certain amount of time or?
That's a good point. You've probably seen an overdone face, and you and I have
Yeah.
both seen that. There are times where I think you need to dissolve that's the good thing about fillers. It is reversible. If we're talking about 2 options of volumization, you've got fillers, safe, dissolvable.
Yeah.
Then people talk about fat grafting. The issue about fat grafting is it's somewhat unpredictable and it's permanent. Once you make a mistake, it's very difficult to,
Right.
reverse. But
But that just goes back to trends, right?
Yeah.
Because I'm hearing a lot of patients now, they're like, oh yeah, I did a fat transfer to my face. And I'm like,
Yeah.
oh no, because it could shift. It
Yeah.
could, it dissolves. It could look lumpy. It could,
Right. And I do a lot of revisional surgeries for fat grafting. Here's an example. Some people will fat graft in that tear trough right here in the lower lid. And I've seen it where it's been a little too lumpy
Right.
and I have to surgically remove it. It's very, very, very challenging. So once again, you want to go to a very experienced, either board certified plastic surgeon or a certified nurse that's injecting. Got to be careful with injecting and volumization, I think.
Yeah. So I want to know, when you go in though, when you say, because I actually have never been in that surgery, when you see there's fat pockets.
Right.
So you just remove it?
Yeah, so that's a
Okay.
good question. Now you're talking about the lower lid is a very complex area, and when you look at someone, they might have a little bit of fullness, we call them bags, or they can have a little hollowness. And what's interesting about the lower lids is that you can actually have different options. You can fill the valley, if you will, to make it smooth, or you can take away the bag, which is the hill, the fat pocket, and that's more of what I do surgically in order to have more of a permanent result. So one thing about fillers is we know they're not permanent. They last about 1 or 2 years.
Right.
But once a person has noticeable large bags in the lower lids, that's when I'll come in and do a lower lid surgery to remove the fat. And we get amazing results. I love eyes. Eyes is like one of my favorite. It's a very quick, less than an hour surgery. And people just look so refreshed. We communicate with our eyes.
It's the pathway to the soul.
It's the window to your soul.
Oh, the window.
Yeah, or something like that.
Well, that's very great. Thank you for giving us that information.
Yeah.
Well, y'all, thank you so much. We're getting to the end here. Thank you for tuning in and listening to us on Go Country 105.
If you want to do a consultation with me and or my beautiful injection nurse, it's 1-888-900-9065, 1-888-900-9065. Our website is faceletterndbody.com, and follow us on IG at Face and Body Plastic Surgery.
If you want to listen to us, tune in every Sunday morning at 7:30 on Go Country 105 with Beauty and the Blade, where beauty begins.
Right with the night food slave.